Good morning, good afternoon, wherever you are. It's great to have all of you and have this opportunity to have a little chit chat with you all in terms of how we think about health equity and mental health, the daunting challenges that we face, and how our new portfolio fund aims to address this vast space with some unique approaches. So I'm going to ask Gregor to just pull up the slides, and then we'll get the show going. Fantastic. Our fund is focused on health equity and mental well-being. So we'll talk a little bit about what we mean by health equity, particularly in the US context, since we're based here in New York. And then mental health being actually one of the areas where health inequities are particularly stark. And something that the field just hasn't really fully addressed. So that's why we wanted to bring out the mental health component in the name of our fund to call special attention to this arena. So let's go to the next slide, Gregor. So just a very quick intro about ourselves. I am a professor at the City University of New York, School of Public Health, and a policymaker, researcher, scientist for over 20 years in the area of community health and disease prevention. Much of my renown in the scientific world has really been my leadership nationally and globally in pushing for a systems approach to public health and population well-being. And I'll come back to that because some of that does bleed into our philosophy in the fund. So I'll say a little bit more about that. And in the last few years, I've also served as the founder and director for a very unique public health entrepreneurship platform called Firefly Innovations, housed within the City University of New York School of Public Health. And that has been a tremendous opportunity for us to build an ecosystem of startups, collaborators, investors, and other stakeholders. And in many ways, that's been crucial in setting the stage for the fund that we're just now launching. So Gregor, you want to say a few words about yourself?
Yeah, absolutely, Terry. Thanks so much. Gregor Hoffman here, investor, advisor, and operator. Have had the experience over the years of working in a number of areas within mental health and health equity, notably telepsychiatry, addiction care, managed care, and now serious mental illness. And it's a pleasure to be here with you all today.
Great. Next slide, please. So for today's presentation, we'll basically split into three major sections. We'll first talk a little bit about the problem of health equity and mental health, particularly with an eye towards the US. We'll then present kind of the broader landscape of opportunities, just a very high-level overview of where impact investing as a field is going. And that's particularly relevant because our fund is designed to be impact-driven. And then also the landscape of health tech and digital health in particular. And then Gregor will finish us off with a little bit more detail about our specific solution, that is COREangels Health Equity and Mental Wellbeing, the portfolio fund. Next slide, please. So I don't think that this would surprise anyone here online that we are faced with a tremendous set of chronic disease epidemics. This is I think even more true now in the I should say, COVID world. We're not exactly post-COVID yet. Here in the US, you probably heard a lot about the high prevalence of obesity. We have one of the highest obesity rates in the world, developed and developing countries combined. And that has had a tremendous impact on our chronic disease rates. 60% of US adults have a chronic disease. More than 40% of US adults have 2 or more chronic diseases. And a lot of this is preventable, actually. Most of this is due to poor diet, physical inactivity, and smoking, alongside, other lifestyle factors. And worldwide, 41 million people are killed each year due to chronic disease. Indeed, setting COVID aside, the vast majority of morbidity and mortality around the world are due to chronic diseases. And we also know now through COVID experience that chronic diseases such as obesity actually predisposes individuals with COVID for increased risk of severe disease and death. Next slide, please. But alongside the, or I should say, in addition to known behavioral factors that predispose individuals to these high rates of chronic disease, it's also really important that we recognize the essential role of social determinants of health. And so what this means is that many of our choices, our behavioral and manifestations in terms of diet, physical activity, sleep, for example, they're not just due to our individual willpower or free choices that we make. Indeed, most of our behaviors, if not all of them, are influenced by socioeconomic factors, factors in our physical and social environment, also in terms of our access to quality healthcare. And that's particularly important in the US because we don't have universal healthcare. So recognizing that these social and structural issues really drive how people eat, how people exercise or not, and how people behave in their day-to-day life is absolutely critical. And the problem with a lot of our health solutions to date is that they don't really tackle these upstream factors, upstream drivers of the health outcomes in question. Therefore, we're sort of just treating the surface of the problem, but not actually getting at the root of the problem. Next slide, please. So in addition to this kind of somewhat grim picture overall in terms of just population challenges around chronic disease, we also know here in the US that we have severe disparities in terms of how different populations experience chronic diseases. So here, for example, I just show you a sampling of these disparity statistics. Among Blacks, for example, 1 in 6 have diabetes compared to 1 in 10 among white American adults. Even worse, in terms of uncontrolled diabetes, we see that if you look at Blacks in the green bar, Latinos in the red bar, we're talking about 2 to 3 times the prevalence of uncontrolled diabetes compared to white Americans. Down below, you see a similar picture in terms of hypertension, where Blacks are at a significantly higher risk for hypertension compared to whites. And oftentimes when populations have equal access to healthcare, they still end up with different or disparities, I should say, in terms of outcomes. So here you can see that the rate of death from heart disease among Blacks is significantly higher than the other groups. And what's even more alarming is that we're seeing these disparities very early on in life in children. Let's go to the next slide. So we'll see, oh, actually, it's going to come later. I'll show you actually some of my own data from my own research where the disparity in obesity among different groups of children is really, really stark, and even more so in the context of pockets of reduction in obesity rates due to the population interventions that we've implemented. But coming back to mental health, so we talked a little bit about chronic diseases in general. Mental health is also a big challenge, and we're calling specific attention to this in part because of Gregor's expertise in this area, but also just because in the US in particular, mental health is still something that it's still a little bit of a taboo. People don't seek out mental health care even when they need it. And yet, the prevalence of American adults experiencing mental illness is massive. So in 2020, it was reported that we're talking about at least 20% of US adults. We know through the COVID experience that that number is likely to be much, much higher, maybe even double or more. This is also happening in concert with huge increases in substance use, in drinking. In the US in particular, we have a huge problem with the opioid epidemic. But at the same time, there are lots of opportunities, and Gregor will get to this because through COVID, we've seen a huge surge in virtual mental health services. This is now mainstream because of COVID. That's one of the silver linings of COVID is that virtual care is now fairly well integrated into the healthcare system, and it's not going away. Partly because of these technological advances, we've also seen a huge increase in investment in mental as well as other health technologies. Next slide. Mental health disparities are also a big challenge, just like chronic disease disparities that I talked about earlier. Here you can see that among adults who could benefit from mental health treatment, Black adults in the US, only half of them, half of the rate compared to white adults actually get care. This is also true in terms of children, and maybe the disparity between racial groups is even more severe among children. Next slide, please. One of the reasons, besides not having health insurance, not being able to access care, social cultural taboos around mental health, another really important reason that I think just the field hasn't fully dealt with or figured out a solution for is how to create cultural alignment in the care that is being implemented and delivered. It's really striking that when a survey was done among white healthcare providers, more than half of them reported having no form of cultural competency training, and that they believe that their patients do not adhere to the treatments as a result of cultural or linguistic misalignment. So we'll come back to this because a couple of the really interesting startups that Gregor will introduce to you all actually is trying to crack this code and deal with this problem. So this is an area that I think is going to be, we're going to see a lot of growth in the health equity space and health tech space. Next slide. So I alluded to this earlier, I was thinking ahead that one of the key things I want to draw folks' attention to is that even when we're succeeding in bringing down the population average in terms of a chronic disease or mental health prevalence rate, we may actually be widening the disparities. So this is just one example from my own publication where we tracked childhood obesity rates in New York City. And you may know that New York City has been one of the most aggressive localities in the US in terms of implementing multi-pronged solutions to tackle childhood obesity over the last 20 plus years, let's say. So indeed, we've seen some good evidence that there's been a decrease in terms of the population prevalence of obesity over time. The decrease doesn't look very drastic here, but it is statistically significant. But what we've also noticed in our work is that the decrease in the prevalence of childhood obesity is not even across the different groups. So here you can see that, first of all, over time, rates of childhood obesity is much lower among white and Asian American children, represented by the red and blue line down at the bottom. And you can see that there's actually been a precipitous drop in the prevalence rate, I think, demonstrated most strongly in white children in the red line. But at the same time, we're not really making a dent at all in terms of the orange line and the green line on top. Those represent Latino and Black kids in New York City. And in fact, if you look really closely, there might even be an upward tick in the orange line in more recent years. So this really, brought out more nuances in terms of, the sort of success that we think we can celebrate in terms of having, shown some decrease in the overall prevalence rate in childhood obesity among New York City school children. And this is not for lack of effort, I can assure you, because a lot of the public health resources actually went specifically towards the Black and Latino communities, given the higher prevalence rates, at baseline from the very beginning. But it tells us that we're not doing something right. Either the reach is not there, despite a lot of money going into these public health campaigns, or there's a fundamental misalignment between the solutions that we think the communities require versus what communities actually need. So this is, we see this problem across many chronic diseases and across many communities. And these disparity issues have been around for as long as I've been in public health, and I've been in the field for, over 2 decades now. So I think we need more agile approaches to deal with these persistent problems. Next slide, please. So moving forward, let's just really quickly kind of take a look at the overall landscape of opportunities here. So next slide. First and foremost, impact investing is huge. Everybody is talking about investing for social impact. We know that we're in the midst of a huge generational shift in terms of the transfer of wealth from baby boomers to their children. And we also know that these young wealth owners are overwhelmingly interested in social impact. In fact, more than half have reported having intentionally stopped investing or declined to invest in a company because of the impact or lack thereof of a company's product or service on people's health and well-being. So these are in some ways very encouraging. It tells us that, here's an opportunity to really create an alignment between this newly emerging investment community and our passion, for impact in the public health space through the sourcing, creation, facilitation, cultivation of new businesses. Next slide, please. This slide just shows in terms of actual increases in sustainable investment assets from the mid 2010s through 2020. And you can see this massive 42% increase in terms of actual dollar amounts. Next slide, please. And when we talked about social impact or being impact driven, first and foremost, you could do social impact in anything. It doesn't have to be in health, right? What's most important is to be intentional, to be measurable, and to be accountable. These three criteria have to be part of the DNA of what you do, baked into your business model, whether it's a fund that we're talking about now, or individual startups. And I think partly what sets our portfolio fund apart is that we take this really seriously, and we want to be more in the green area of this chart. And because both Gregor and I are coming to this from a public health trained perspective, we're also particularly interested in evidence-based public health. So we don't want to just invest in companies because they have a product or service that sounds sexy. We actually want to know that it works, that it's been tested. And actually, our first investment in the fund, I think, demonstrates this particularly well, which is why we're so excited about them and their product. So part of the ethos that we bring to the fund and the startups that are in our fund is that we also want to help them develop and grow their evidence base. That's what I do day to day in my day job, to do research, conduct experiments. And so I think that's a very unique contribution that we as managers of the fund can bring to the startups in our portfolio that might set us apart, from other venture funds, out there in the marketplace. Next slide, please. And just really quickly, at the outset of launching this fund and even implementing Firefly Innovations, our public health entrepreneurship platform, it's really this recognition and appreciation of the beautiful intersection of business and public health and why we need more of it. So business can contribute to public health by providing agility to create, to fail. We want to fail rapidly and a lot in order to arrive at true innovation. Businesses also can provide models for sustainability and scale up. The vast majority of public health R&D never goes anywhere because people working in public health don't understand business modeling. They're not taught to actually develop business models. Obviously, to make something sustain, make something scale up, it requires technology, it requires marketing expertise, it requires business development, all of which are not taught in the public health discipline. And then, of course, private capital, I think, is critically needed in addition to funding from the public sector for reach and growth. On the other hand, I think public health can also bring a lot to businesses and to the venture community in particular. First and foremost, here in the US, there's such an emergence of interest and recognition of the importance of diversity, equity, and inclusion. This is what public health people are trained in. We can bring this unique lens and our deep understanding of social determinants to business solutions that are coming out of the business world. We can't talk about impact if we're not talking about monitoring and evaluation. Most companies don't know how to do this. Public health people do. And so by working together, we can actually facilitate our advancement in real impact investing. Obviously, with the scientific expertise that public health folks can bring to the table, this immediately increases the public and scientific credibility of businesses working in the health space. And in a lot of the work that we do through Firefly Innovations, for example, we've come to recognize that many founders have a real need to figure out how to validate their products or services in actual communities. But they don't have that expertise because they don't come from the public health or social world. They may have an engineering background, a business background. So again, collaboration in this space can really actually help facilitate the R&D of individual startups. Next slide, please. So I think here I'll pass on to Gregor to just give you a very quick overview of the landscape of health tech in digital health. You're on mute, Gregor.
Can you hear me now?
Yeah.
Thanks, Terry. It's great to learn from you as a professor and an innovator. Thanks for going into the problems at a macro level around public health and also the opportunities, big picture. For the rest of the time, we'll first go through some more slides and then have a discussion. In terms of the content here, really excited to double click on the opportunity landscape, specifically with startups in various sectors and with actual specific startups, and then go into the fund that Terry alluded to. So there's a breadth of solutions here within the digital health landscape. We don't need to go into all of these and don't have time to really even scratch the surface today, but wanted to show how much innovation is happening and how many innovators are out there really trying to make an impact on some of these problems. And going deeper into a few different segments, we can see how there are tailored approaches to Medicaid, which is often low income and children in the US. There are solutions that are tailored towards Medicare, often older Americans, and it's a significant amount of government spending alongside what employers are putting in to cover health insurance and what individuals are paying themselves. But if we really go deep on this Medicaid segment, we're talking about 1 in 4 Americans is covered by Medicaid. They're low income and in need of health equity and mental well-being. Tying this back to the public health themes that Terry went into, individuals who are low income are have a greater burden of chronic diseases. In addition, where we have coexistence, comorbidities on the mental health and physical health side, there's even more of a dramatic correlation with higher disease burden. So wanted to touch on this Medicaid market map and say there's often 2 types of opportunities and startups that are tackling this. There are those that are providers and those that are building the infrastructure and enablement. Within that, we can break it out into a number of different segments, of which mental and behavioral health on the provider side alone presents a lot of opportunity. But let me jump in, get to some of the exciting part and highlight a few of the companies that we're looking at investing in particular MindCo, which is delivering effective and accessible mental health programs. When we talk about VR, that may sound like a buzzword, but when we really look at a clinically validated solution here with some proprietary tech, VR training that's effective and can be a high ROI for any number of customers across employers, internationally with different governments and many other stakeholders, we start to see a story of impact and traction. And in particular, we're looking at something that can be accessible across all different demographics. So very excited about what MindCo is doing. Can go and do a full hour or many hours into everything exciting happening with MindCo, but want to go a little bit deeper on a couple of other opportunities as well. Next, 2 out of 3 here, I'll talk about health inner Hue. Terry had mentioned health inner Hue. They were in that Medicaid market map. And what health inner Hue is doing is addressing health equity, and especially the mental well-being angle, by helping women of color connect with the appropriate providers for them. And particularly in the US, this is a huge gap from a outcomes and accessibility perspective. So Health Inner Hue has been doing some phenomenal work and checks a lot of the boxes in terms of moving the dial on some of those measurable pieces that Terry had highlighted. Third and lastly here, we can talk about Candlelit, which is focused on culturally relevant perinatal mental health care and making that simple. So really focused within a particular segment, and then the solution is trying to go deeper on mental health, in particular for moms of color throughout that whole journey. And so when we talk about perinatal, there's the pre, the during, the post, and there's so much there. Such an important time, both in the life of the mother, the child, and community. So I'm really excited to highlight Candlelit here as well. And let me talk about a solution here within COREangels. We talked about the health equity and mental well-being fund that started. And the goal of COREangels is to empower some of the entrepreneurs that are building those 3 companies that we highlighted: Mindco, Health Inner Hue, Candlelit, and many more that we hope individuals here on the line are going to build in the coming years. So we can talk about the COREangels network. We have a number of people here from COREangels and who are part of this international angel investor community. But really, it's done a great job professionalizing angel investing and helping entrepreneurs like those who are building these companies that we highlighted launch innovative ventures, and get them to a place where they can make a huge impact. Going deeper on this COREangels group, COREangels Health Equity and Mental Wellbeing, it is an angel fund that's based in New York, where Terry and I live, and we're bringing together impact-driven investors like some of you, as well as these early stage ventures like we highlighted, to reduce health inequities, including mental health, through a multidimensional lens of well-being, which I'll get to in subsequent slides. And one, to reiterate that the fund is committed to cultivating diverse women founders with lived experience of the problems that they seek to solve. So what is the multidimensional approach, this person-centered approach that I just alluded to? It has 5 components, and within that, we're really highlighting the thesis of this group is around clinical, social, environmental, financial, and emotional/behavioral dimensions. This public health lens on impact beyond just the financial returns of a startup is so important and different from the prior approach. Having been in the space for over a decade as an operator and entrepreneur in the mental health and healthcare space in the US, I've looked up, and in many ways, a lot of the problems that our new solutions sought to solve, honestly, are not solved. And in many ways, in part due to COVID and other public health trends, are worse in many ways. And how do we come to terms with that? This group is trying to acknowledge that to some extent, we haven't been taking a person-centered approach, and new solutions like those that we highlighted here with specific startups and the landscape really need to take a person-centered approach that factors in all of these very important elements that are not always present with all newer opportunities. And those individuals who are solving problems that are very experienced by them, that they have that lived experience with, we believe are more likely to take into account all of these multidimensional facets that are so important and maybe left behind by others who are solving problems from more of an intellectual perspective as opposed to a lived experience perspective. A final two slides here. One, want to shout out that there are a lot of innovators and co-investors who support many of these businesses alongside us. They fall into a few categories, and would say that there can be more investment, and want to encourage everybody here to spend more time with academia and research, supporting accelerators like Firefly that we had mentioned, as well as communities, online and in person. And then there are impact investors. There are health-specific investors, and there are venture studios, and they all play an important part in this ecosystem in order to support these new startups and the founders and founding teams that are building these companies. Lastly, final slide here, want to go into some specifics about what to expect for a portfolio fund with an angel ethos that we've been talking about. Over the next 5 to 10 years, what are we looking at? We're looking at bringing together about 30 individual angels, a few institutional angels, and 25 or so startups, with smaller checks for individual angels on average, larger checks for the institutions, and then deploying typical checks of between 100K and 150 to these startups. And so what does this look like? Over the next 5 years, the focus is on fundraising as well as deploying capital, with the tail end being focused on realizing exits across these startups in order to help deliver returns to those that put forward the capital to drive both the business creation as well as the returns on impact that we've been talking about. So thank you, everybody. If you have follow-ups, you can send us a note here in the chat or by email, and really look forward to connecting with people on LinkedIn and in person as we're continuing to build this community and COREangels network that's dedicated to health equity and mental well-being.